This is the case of Anna Visco, who has high-functioning autism. Her treatment goals are within 3 months, Anna will demonstrate 3 appropriate strategies for dealing with strong feelings and having improved self-regulation. Within 3 months, Anna will also demonstrate improved social thinking as evidenced by her ability to communicate collaboratively with peers during a game or activity about 50% of the time. Within 6 weeks, Anna will apply 3 of these strategies to adapt to transitions in a positive manner, and by 6 months, Anna will demonstrate self-awareness and self-esteem by improvements on the self-rating scale. Some safety considerations and contraindications are self-harm and frustration, misinterpretation, hitting or throwing, zones of regulation like high red zones, and lightweight items that, if thrown, will not hurt other classmates, and sensitivity to noise and light. The equipment needed is a visual board and scheduling and emotional identification, a visual toolbox which will include a move and sit, options for breaks, sensory tools, and strategies to help cope. A therapeutic stress ball will be used as well, and we will work on association with emotion to situations such as the matching game. The treatment plan will include introduction and explain the treatment session, such as consent, risks, benefits, the role of the OTA, outline the session using a visual schedule board, and introduce the sensory ball to promote focus during the session. Zones of regulation matching game will take place, and then we'll provide educational handouts to teachers and parents. We will ask if there are any questions and bring the session to a close. The observations are the stress ball is aided in focus during oral treatment activities, difficulty coming up with strategies to deal with each zone of regulation, and difficulty associating emotions with the visual characteristics. A subnote will be provided for client record. There will be home programs provided to educate teachers and parents to implement strategies and explain different zones of regulation. For next session, we will implement more social expression strategies. Teach the family how to use a move and sit cushion to help facilitate. Information communicated to the supervising therapist will be observations and how we should continue to progress with the client.
Hi, you must be Anna. It's nice to meet you. My name's Parker. I'm an OTA PTA student at Durham College. This must be your mom. Hi. Today we are going to do some exercises with a visual schedule board. The benefits is that we're going to be working with it to help identify your emotions and decide which strategies we can use to control these feelings. Some of the risks of these activities is you might feel like you're getting frustrated or upset, but these will help you start socializing with your classmates and help you feel more comfortable with participating in their activities. Do you guys have any questions for me at all?
No? Do you have any questions?
No? Okay. And is it okay if I work with you today?
Sure, let's do it.
Okay, let's get started. This is a visual schedule board, Anna. So using pictures, we are going to plan out your daily schedule and things you like to do during the day.
Doing this activity will provide structure and visually show Anna the transitions that will be made throughout the session. Building the schedule together will give her some independence, and removing the pictures when we are done with the activity will allow her to see how much time we have left.
So, Anna, this is a picture of your visual schedule board that I made up for you. So this is a picture of the actual visual schedule board. So we're doing that right now, right? And then we have a picture of your stress ball, a matching game, and then at the end we're doing some tidying up. So can you guess which one we're doing right now? Perfect. Yeah, exactly. So we are going to learn how to use a stress ball today. So can you point to that on the visual schedule board for me? Awesome. So before we move on, do you want to remove the first picture? Awesome. So now I'm going to show you how to use a stress ball. So this is the stress ball. So this is a sensory tool that you can use when you're mad, frustrated, fidgety, nervous, or sad. So all you have to do is just squeeze it. Do you want to give it a try? Yeah, how does that feel?
Yeah, it's okay.
It's okay? If you don't like it, let me know and we can try a different material if that doesn't feel good to you.
Using the stress ball will allow Anna to channel her emotions through a sensory tool. This is simple to use and can be used in any environment such as school, at home, or on the go. as well as it will make it easier for her parents to help regulate their child's emotions when the child is in a stressful situation.
Okay. So you can use the stress ball throughout the session while we're going through it, as well as you get to take it home today. So you can use it whenever you want, okay?
Okay.
Okay. So I'm just going to move this stuff out of the way so we have some more room. Okay. So we're going to take the stress ball photo off of the visual schedule board. So can you take that off for me? Awesome. So that's 2 things we did already, okay? So the next thing we're going to do is we're going to play a matching game. Okay, so let me just bring it up here. Okay. So it's based on your favorite movie, Inside Out. So the game is called the Inside Out game of Zone of Regulation. So the zones of regulation help us determine our emotions by using different colors and facial emotions to express our feelings. So for this game, we are going to match the different colors with words that go along with that color, as well as we're going to play strategies that would help you when going through these emotions.
This activity will allow the patient to identify their emotions and learn the different zones of regulations, as well as it will give strategies to help the patient when they are experiencing these strong emotions. It allows the patient to feel a wider range of emotions and explain how they feel and use in an empathetic way when interacting with other classmates, which will improve social skills.
Yeah, sounds fun.
Okay, so here is the board. So we are going to use these pieces, so the words and the pictures. So I'm going to lay them out. You're going to let me know which one you think is going to go in the blue row.
This one?
Yes.
Sad.
Yes, good job. So sad regulates with blue. So now I want you to try and match the rest up.
That one? Red.
Awesome. Okay, so now we're going to talk about the strategies we can use for different when we're feeling angry. Which one do you think would go in the red zone?
Swing.
Swing? That would probably go more for feeling frustrated or happy. The one I was thinking about is maybe a stress ball or doing some quiet time reading, okay? So that would better benefit you if you're feeling mad or angry. And yes, so that's a really good job. So we're gonna put the board away now, and we're gonna take the picture off for the memory or the matching game. Yes. Perfect. So, Anna, here is a handout that I'm going to give to your mom. It explains the different zones of regulations and what some of the strategies are that we learned today at our session. So I'm just going to give this to you so you can take this at home and kind of educate yourself on what we did today at the session. I know you saw some of it, so it might just be helpful to keep at home.
Okay.
So anyways, do you have any questions for me, guys?
Not that I think of, no.
Keep this?
Yes, you can keep that and bring it home and use it whenever you want, okay? So I will follow up with the OT and let her know how the session went. And I will see you guys next week, and we will continue to expand strategies for her for at school and at home, okay?
Okay.
So it was really nice
Thank
to
you.
meet you. Okay, bye, Anna. Can I have a high five? Good job. All right.